Now, is everybody on Poll Everywhere? Okay. All right. So once you are on Poll Everywhere, yes, Hope. Did you put Poll EV, not EY? Okay, bring your phone up here and we'll look at it. Okay, so thank you all for joining us. This is Adam Payne. He is a friend from university, and he is going to talk to you all a little bit about kinesiology and med school. So I would love for you all to make sure that you're not on your phones and you're paying attention because he has some really awesome information for you. Adam, I'll let you take it away now.
Perfect. Hi, everyone. Thank you for listening and for having me. I'm excited to be talking to you today. I wish I could see you all or at least interact with you, but this is what we have, so we'll make the best of it. So I wanted to be very interactive, so I made a poll everywhere so that you could be engaged. But also, if you have any questions, feel free to I'm just gonna take these out also. Can you hear me?
Yeah.
Yeah, okay. If you have any questions, feel free to raise your hand, to ask your teacher, to shout it out, whatever it might be. I want it to be very informal. So just a little bit about me. So I'm from, on the bottom left corner, I'm from Corner Brook, Newfoundland. So quite a small town. And I've always was kind of interested in sports and interested in science. And that's what's led me to pursuing kinesiology. So here at the bottom right photo, you can see the new kinesiology building at the University of New Brunswick. And then from kinesiology, I actually decided that I wanted to go into medicine. So on the top photo here, I'm currently in my 4th year of medical school at the University of Ottawa. So soon to be a doctor, which is exciting. Come July 1st, I'll be a baby resident, so a baby doctor. So that's very exciting. And then just a little bit about me outside of medicine. So medicine can be kind of stressful and it can be quite all encompassing. So it's important to have hobbies that you establish even as early as high school, so that when you do feel overwhelmed or that things can be a bit busy, that you have those things in place. So I like taking pictures. I like playing beach volleyball. I actually went to beach volleyball nationals, which is a fun fact about me. And I like traveling when possible. So finding things that you can do to relax and to de-stress, especially if you decide to go to medical school, because it can be quite busy. So time to get involved. Maria's kind of giving you all a poll everywhere. So just make sure that you're on that. And then the first one that we will do, you should see it coming up on your screen, is that I want you to take your best guess of where Corner Brook, Newfoundland is on this map. So this is a map of Newfoundland and Labrador, and I want you to take your best guess of where it is, and I will share the results once we have enough. We have some good responses coming in, quite varied. We will just do this here. So I'll bring up. You can see that, right, Maria?
No, we just see like the poll EV time to get involved.
Oh, oh my gosh, why does this keep happening? You can see it now?
They said your question's changing.
Ah, what do you mean?
They said it was fine, like the map was up and then the map disappeared.
Oh, okay, that's weird. My apologies, everyone. I don't know what is happening.
That was weird at work last time. Cole, stop playing with your money. Put it away.
Let me just see here. This is the beautiful thing that is virtual
I wonder, there's a button where I can click request control. I wonder if I can control your power. Oh, it's back. They said it's back.
We're back. Okay. And then if I play from current slide, can you see it?
No, stop screen sharing and start screen sharing again.
Okay, will do. This is awesome. There we go. Can we see it?
Yeah, we can. We can see it.
Okay, so I'm not in the presenter view, but lots of different responses, and you can see my mouse when I'm in this view, correct?
Yeah.
Yeah. So this up here is actually Labrador. So for those of you who said that, that's a different part of the province. And this here is Newfoundland. So lots of votes here today. But actually it's right here. So there's two people that picked right here, and they are correct. So congratulations. I wish I had a prize or something, but I guess you just get bragging rights. So the next question that I have is I'd like you to type in on the poll everywhere what you're interested in. So from you can see it popping up there now, from a perspective of where you could see yourself working, what sorts of jobs that you might be interested in, just so that I could tailor the presentation a little bit to figure out if there's certain things that you might want to do. So we'll let it pop up here. So there's the trucker. There's a lot of other things that aren't coming up here, but we're delayed. But a lawyer. Oh, there we go. So lots of different things. Wow. Okay. Okay. I hope that a few of these are jokes. Something that's good. I mean, it's okay not to know. Engineering, filmmaker, lawyer. So lots of different things here. So I'll keep moving forward, and yeah, we're quite varied, so that's great. So kinesiology. So what is kinesiology? So the next question will just be kind of for you to type in. What do you think kinesiology is if you were to pick one of these four? So we'll just give you some time to think about it. Okay, so we're trying to decide between the two. We'll give you 5 more seconds. So 5, 4, 3, 2, 1. Okay, final votes are in, so we're locked up. So okay, I think only a few people said the middle two, so we can start there. So the science and practice of caring for a patient or managing their diagnosis and providing treatment is actually the role of a doctor. So that one's a doctor. The one below, the mechanical laws relating to movement, is actually biomechanics. So it's essentially the study of physics and looking at the body. So biomechanics is actually a component of kinesiology, but it's under like a subset under kinesiology. The actual definition of what is a kinesiologist or kinesiology is the study of the body and how it moves. So it best fits with D, the study of mechanics of body movement. When you look at A, this is a tricky one, but it's looking at how psychological factors influence sport. So that would be kind of on how the brain influences sport. So this would actually be sports psychology, which is actually a component of kinesiology as well. So you have kinesiology, and then you have sport psychology, and you have biomechanics, which fall under kinesiology. So I'll play from the current slide here. So kinesiology, as I said, in simple terms, is the study of the body and how it moves. And there are two components at the University of New Brunswick. Just a disclosure, I went to the University of New Brunswick, so this is a presentation based off of that, but every school has their own program and their own differences. So I did a Bachelor of Science in Kinesiology, which is more geared towards people who are interested in science pathways, in pursuing careers in science. And then here you have the recreational sports study component, which is more geared for people who are interested in being teachers, working with teams, doing sports business side of things. So if you have more of a hands-on, an affinity for hands-on careers, then that might be a better choice for you. But this talk will be basically focusing on the science of kinesiology, since that is what I did. So wondering if you could type in some careers that you foresee yourself, like if you did a degree in kinesiology, what sorts of careers would that be opening for you to pursue? So let me phrase that in a different way. So if you did a degree in kinesiology, what sorts of jobs would you be able to do after that? So we have a lot of physiotherapy, sports medicine, doctor. Obviously, that's a good one. Chiropractor. Yeah. So these are all kind of along the lines of things that you could do. So it sounds like you guys kind of have a good understanding of that. So as we said, it's an excellent choice for people who are interested in health-related professions. So things such as medicine, physiotherapy, occupational therapy, chiropractor, athletic therapy, massage therapy. And then specifically, if you're interested in fitness or coaching or teaching or ergonomics, which is kind of the study of how things can be designed to make it more comfortable or to be more effective. For example, like sitting in a desk, and the impact that can have on your performance and your health. So these are all different components that you can integrate into your career if you want to be a kinesiologist. And you can also work as a kinesiologist in itself. I did that myself for 1 year, but oftentimes with kinesiology, you need to kind of pursue secondary education. So build upon it. So if you want to do a physio or occupational, that's extra training after kinesiology. So if you are interested in the a Bachelor of Science in Kin, and you want to go figure out what it's all about, there is a link to this video at UNB where they kind of talk all about the program. Here I'm featured with an unfortunate pair of glasses that I used to wear. So you can go watch that if you're interested. So a little bit about the requirements. So as high school students, this is probably one of the more important slides for you. So if you are interested in kinesiology and you want to pursue that, there are certain requirements that are recommended. So English or French, pre-calculus, 2 different types of sciences. So whether that's biology, chemistry, or physics. I will disclose that I actually hadn't taken a biology class before going into kinesiology. I think I was probably one of my only classmates who did that. But you don't have to. You just need to have 2 of the 3. And then a minimum average of 75. And then there are some other specifics for UMB and for other programs that I'm sure your teachers or your guidance counselors could help you with if you have questions. But it's important when you're picking classes that you understand what's required to get into these programs if you're interested. And there's a full list on the UMB website, or other schools will have full lists as well. And then what are some sample courses? So kinesiology is quite varied. So we have a lot of different courses that you could take. There's biomechanics, which I said is kind of the physics of the body. So I did my honors looking at different people walking up steps and the effects of the forces that it could have on these people's knees. There's sports psychology, which my partner is actually completing her PhD in, looking at mental health in sport. So sports psychology is kind of the field of how our brain affects the performance, and also things like how interacting with patients or our mental health can affect how we perform. Ergonomics, which is an interesting class. I spoke about it's looking at the design and how that affects your ability to work. And a lot of people now are kind of getting hired to come into businesses and to talk about ergonomics of the workplace and how to increase productivity. And then something that's very important for understanding, obviously, the study of the body and how it moves would be anatomy. So understanding the anatomy of the body, what it looks like, the different components, because you need to kind of know that in order to understand in a deeper level. For kinesiology, something that's also great is that while there's a lot of stuff in the classroom, there's also a lot of opportunities to get involved outside of the classroom. So there's lots of hands-on. There's the motion analysis lab where you can watch people with like exoskeletons who can't walk and kind of analyze their gait. There's the skill performance center, so looking at highly trained varsity athletes and kind of working with them. There's practicums, like I did my practicum looking at prostheses. So how patients that need prostheses are going to be using them in their daily life. And I would just say kinesiology in general is a great path for if you're interested in getting hands-on learning experience outside of the classroom. There's lots of that. So some general skills you'll acquire, I took this from the UMB website, but essentially understanding physical activity and health, being able to interpret different types of movements, understanding the impact of age on movement, and then being able to work well with others, being able to communicate and work in a team environment. So that's it about kinesiology. I'm wondering if anyone has any questions that they'd like to ask out loud, or anything that I didn't address. And if not, then we can move forward to like the medical school component of it.
Do you guys have questions about kin at all? Not yet.
No, perfect. So hopefully we'll have time at the end for questions if you'd like. But otherwise, feel free to interrupt me if you want. But that's a little bit about kin. So we'll switch gears a little bit. So my next question to you is, do you need a science degree to get into medical school? So you can see that open on the poll everywhere. And last time this was a controversial one. So we were split. So I'll be interested to see what we think this time. So I'll just exit and then we'll go over so that we can all see. Okay, so we're split again. So we'll just give a few seconds for the last results to come in. Seems like no, people are not sure. Oh, okay. So 3 more seconds. 3, 2, 1. Okay, we're locked in. So we're pretty split on this one. So in fact, this is quite a common misconception. And you actually do not need a science degree to get into medical school. So there isn't one particular way that everyone goes into medical school. It's quite varied. While you don't need a science degree, we will talk a little bit more about some of the important classes that you have to take. But I have friends in my class who have taken music degrees, engineering degrees, nursing degrees, psychology degrees, and business degrees. So it can be quite varied. Obviously, if you study science and you understand how the body works and you have a little bit of an understanding of the background science, it does help you moving forward because you have a better understanding, but it's not required. So again, disclaimer, I'm go to U Ottawa, so this is from a U Ottawa perspective, and each medical school is completely different in what they require. So if you have a specific school in mind, make sure that you look it up when you're kind of considering applying. But something that's another misconception is that you have to have done an undergraduate degree, but really you only have to have 3 years of an undergraduate degree done. Most people will finish their degree and then apply after, but it can be a program here. It says in any undergraduate program. So it doesn't matter what the program is. The only requirement is that you have a grade of B as your GPA or your collective average, and that you take these prerequisite courses. So on the bottom here, I have some of the courses that you must take. 3 credits is a class. So, for example, you have to take 2 classes of humanities and social sciences, 2 classes of biology, 1 class of organic chem, 1 class of chemistry, 1 class of biochem, and 1 class of stats. So, how this would look is that a lot of the programs allow you to tailor your education or to tailor your classes as you need. So, if you wanted to do something in, say, business, you have a lot of flexibility where you can take electives, and you would have to use your elective time to take these science courses. So although you don't need a science degree, there is some degree of science that you would have to incorporate into your degree in order to be considered eligible. So if you were interested in medical school, it's important to understand this, because in your last few years of undergraduate education, you'd have to make sure that you have the requirements to apply. So I'm not sure if any of you know anyone that has applied to medical school or any doctors, but the process for applying can be quite daunting. It can be quite extensive and honestly difficult to navigate. So I'll talk a little bit about it here. So there are a few steps that are important. So the first one being writing the MCAT, which is a national exam that talks about a lot of different sciences, social sciences. There's a writing and reading component, a critical thinking, and it's an 8-hour exam, so it's pretty wild. And you get compared to everyone else that writes it on the same day. And that is a national exam that's used to determine your entrance into medical school. And that's kind of what gets you that foot in the door, the beginning of your application. Other components are your transcript, so how you do in your undergraduate classes, your autobiographical sketch, which is how the schools get to know a little bit about you, and this talks about everything from high school, like the beginning of high school, until you apply to medicine. So if you currently work a part-time job, if you currently volunteer, then that's going to be something that would be included on your autobiographical sketch. So I often say to people that I wish that during my high school, I had kept a list of things that I was doing outside of school, so that when I did come to the time to apply, that I had a list there. So if you're even considering this, maybe considering medical school, maybe starting a list of some of the things that you do, so that throughout your undergrad you can add on that, and then you can kind of use that to guide your application when the time comes. Your reference letters, so this would be either from your professors who you've worked with closely, or it can also be from a community member if you play sports or if you volunteer, that could talk a little bit about why you would be a good doctor. The Casper test, which we won't talk about much, but some schools require it. It's a situational judgment test. So they'll put you in a difficult situation, like such as you're working in a clothing industry that has a no refund policy, and someone comes back with the jeans that are ripped, but they say that they couldn't afford it. How would you handle that situation? So it really puts you in tough situations and kind of assesses how you would respond. And then all of those things go into making your application. And then you submit it to the schools, and then the schools decide whether or not they want to give you an interview, which is ultimately the most important component of your application. And then after that, they decide whether or not they want to give you an admission offer. And it's quite rigorous. And oftentimes, a lot of people will not get in or be unsuccessful in their first time. And that's perfectly normal. So a lot of people spend 2 or 3 years applying before they can even get into medical school. So it's important to kind of keep improving your application, and it shows a lot of resiliency. So here are some of the different medical schools. So I know some of you are French speaking. So the 3 on the bottom right are the Quebec French speaking schools. And I will also note that U Ottawa, where I go, is the only bilingual school in the world, fully bilingual. So it has French and English. The other 3 on the bottom, Sherbrooke, Montreal, and Laval, are French speaking. And then on top of that, I will just highlight for this class specifically that Dalhousie, because New Brunswick does not have a medical school, Dalhousie has specific seats that are open to candidates from New Brunswick, as does Memorial University. So these 2 schools have seats for people from New Brunswick, because it's important to get people from all over. So I imagine that if any of you or some of you are planning on applying, that these schools will be kind of on the top of your list, just given that they hold seats for people from New Brunswick. So I know that's a lot of information. I'm wondering if anyone has any questions about how someone becomes a medical student or about the process before we kind of go into what life is like as a medical student.
Somebody wants to know how much tuition costs to go to med school.
That's a great question. So it really depends on where you go to school. So if you were to go to Dal or Memorial, it's a little bit cheaper than if you were to go to Ontario, which is where I go. So I think my school has one of the more expensive tuitions. So it's about 30,000 a year for tuition, which is a lot. But also keeping in mind that in order to do that, you can get out like a loan. So it's not like I need to be paying it out of my pocket. Also, the government helps by giving you some funding as well. And then this is all keeping in mind that it's an investment in yourself. So although you're taking out money, once you start working, you'll be obviously making some decent money. So that helps to pay back. But yeah, it's a lot. Any other questions, or that's it?
I think that was the last question for my class.
Okay. It's a good question. All about the money. So, this is me on the top left here. And this is kind of a typical day that I would go through. So, I sleep, I drink coffee, I go to classes, I do clinical exposure. Perhaps I work out or talk to my friends, and then I study, and then I go back to bed and I do it all again. So just a brief explanation of what medical school looks like. So from a bird's eye view, there's pre-clerkship, which is the first 2 years, and then there's clerkship, which is the second 2 years. The first 2 years are mostly in a classroom, whereas the next 2 years are mostly in the clinic and working with patients and getting hands-on exposure. So we're going to go over a little bit of what a first year would look like. So you see here that in the mornings, mostly you have lectures. You also on like Tuesday have CBL, so that's case-based learning. So this is when you work with small groups to work through cases. So you might have a patient that comes in with chest pain, and then you have to say, what do you want to do? What do you want to ask? Do you want to listen to their heart? And then as you work through the case, different things come up. And it's a great way to learn because you're applying the skills that you're learning in classes, and then you're also working with a group of people. We have SIM, which is Society Individual Medicine, you can see on Tuesday. And that is more looking at the humanities of medicine. So we get patients coming in talking about their struggles through the medical, their medical journeys, or we talk about how different cultures or different groups are disproportionately affected. So this really puts things into perspective from a humanities side. We have anatomy labs, so looking at like the different types of anatomy, and this can be something that can be really shocking for first year students, is that we have cadavers. So it's people who have passed away, who have dedicated their life to medicine. So you're going to be kind of cutting open the cadavers and looking at their actual anatomy. And then we have on Thursday afternoons, we have physician skill development, which is your opportunity to actually practice on patients, to do physical exams, whether it's looking in their ears, listening to their lungs, those sorts of things, so that you can build on your hands-on skills. And at U Ottawa, something that they pride themselves on is having half days. So you could see here on Tuesday, Wednesday, and Friday, we have the spare time to study, to play sports, to do really whatever, volunteer, do whatever you want to do. So that's something that U Ottawa prides themselves on, but it would be different at every school. The third year is really going to be the year that you get to try out all of the rotations and try to like test your foot in what is the best rotation for you. So for an example, I am in group F. So if we look at the group F column, these are the orders of the rotations that I went through. So I started off with surgery, went to OB, which is when you're doing babies, psychiatry, so that's looking at mental health and mental illness, family medicine, acute care medicine, which is kind of when someone hurts themselves, so they fall or they cut themselves or they go to the emerge, internal medicine, which is really sick patients that need to be admitted into the hospital, pediatrics, which is taking care of kids, and then mandatory selectives, which is kind of a mix mash of everything and a combination of everything that didn't fit into the other categories. So you cycle through in your third year of all of these rotations, and it gives you a very good understanding of what each area entails. And then that's also where you can really pick what works for you and what you like to do. And then in your fourth year, which is what I'm currently in, I mean, we won't go into too much detail, but you have two mandatory rotations. So you have your surgery rotation and your internal medicine rotation. And then the rest of the year is elective, so you can pick what you want to do. So you can tailor your learning to meet your specific needs. So I'm applying to family medicine. So I did a lot of family medicine rotations. I worked with some kids. I did some more emergency medicine just to kind of make sure that I was comfortable with that. So fourth year is really where you can pick what you want to do. And then also you have to apply to your residency programs. So I'm currently in the process of doing that to become a resident doctor or a baby doctor. So that's where I'm at right now. Okay, so it looks like we have the responses from the other one. My computer is frozen, so that's good. There we go. Okay, let's... Okay, so we're going to start fresh here. So these are all medical specialties except for one. So I'd like people to vote what they think is the incorrect answer. So all of these are specialties except one of them are not. Okay, so we'll give you 5 more seconds. 5, 4, 3, 2, 1. Okay. Does anyone feel strongly about their answer? Does anyone feel like, I know
confident that one of them is not right? Which one is not right? You're not confident? Zero confidence.
No one's confident. Okay, that's fair. So let's start with oftentimes when questions are answered in multiple choice, if there are some that look the same, then you could probably suspect that maybe one of those is the right or the wrong answer. So nuclear medicine is actually its own specialty, and yeah, like because it doesn't look the same as those, I could kind of tell maybe there's a trick going on here. So nuclear medicine is a specialty. A lot of medicine is named after kind of Latin. So if you think about what hep means in kind of Latin terms, hep is often liver. So hepatology is the study of the liver. And then heme, so hematology, which it seems like everyone knew that was a specialty. So that's good. Heme is related to the blood. So that's a blood doctor. So the one that isn't anything is homatology, which is something that I completely made up. So I just want you guys to comment some different types of medical specialties that exist. I know we spoke about it, a few, but what type of doctor could you be? What are some different specialties that you can be? Very good. Nuclear medicine. Yeah, it's always good to start off with something that you've just read so you can be sure. Yes, so plastic surgeon. That is in fact one, yes. I see here, so there's a face doctor, there's a foot doctor. Yeah, so there's lots of different types of doctors. It might be hard not to like not the actual terms, but you're right in that there's different surgeons or different doctors that take care of different areas. Brain surgeon, yes. Neurology, very good. OBG, yes. So someone looking after deliveries. There is a P doctor, yes, that's urology. Very good. Urologist. There, we have someone with the full name and then someone that just has the ear doctor. So there's ENT. Yeah. So essentially, any part of the body, poopology. I don't think that one exists, but um, maybe a gastroenterologist would be the closest. But yeah, um, any part of the body that you can imagine exists. There's probably a specialty for it. So this is just an overview of some of the different specialties that exist for doctors. So it's alphabetical, but you can be an allergist or an immunologist. You can be an anesthesiologist, which are people that look at drugs, specifically during surgeries. Dermatologist, so the skin. Emergency diagnostic radiology, looking at reading radiographs, so X-rays. Emergency medicine is more like you're familiar. I imagine you've all seen an emergency doctor at some point in your life or had a family doctor. Internal medicine is those really sick patients that need to go into the hospital. Genetics, neurology, so looking at the brain and how it functions. Nuclear medicine, which we're all experts on now. OBGYN, so looking at babies. Ophthalmologies, eyes. Orthopedics, bones. Pathology, looking at labs and the different cells. Pediatrics, children. Physical medicine and rehabilitation is kind of like physiotherapy, but as a medical doctor. Preventative medicine is trying to prevent things from happening. So you do a lot of that in family medicine as well. Psychiatry is mental health, mental illness. Plastic surgery, I think, explained itself. Public health, which we've seen a lot of in COVID. Radiation oncology, so oncology is for cancer patients. Surgery, urology, the P doctors, and then vascular surgery, which are looking at blood vessels. So a little bit about me, as I said, I'm currently in the process of applying to family medicine. I am doing interviews. I had an interview last night at 8 p.m. actually, and I find out on April 12th. So I want you all to wish for me. So in summary, I feel like my Bachelor of Science in Kinesiology was a really good program and that it really set me up for understanding the body and moving forward into my career as a future doctor. I feel like for anyone who's interested in sports and for science, it's a great option. When you think about medicine, there's no specific path that you have to take. You don't have to do a science background. It can be unique for everyone. And if there's something that you're interested in, then you can feel free to kind of take that route. Just understanding the requirements is important so that you can implement it and that you can kind of make sure that when you get to that stage, if you are considering it, that you've done everything to ensure that you can get there. And then lastly, I'll just leave you with the thought that becoming a doctor is challenging and that it can be a difficult path that requires lots of like resiliency and barriers to overcome, but that it's really rewarding when you first like help your first patient or when you kind of catch something and you're able to help to kind of treat them. It's a really rewarding career path. And there's lots of flexibility and ability for you to tailor it for what you like. So if you're interested in a certain area, then you can completely put that into your practice and that can be the area that you focus on. So it's great that you can kind of integrate things that you like to do into your career. So that's the end of the formal presentation. I will open up the poll everywhere. So if anyone has questions that they want to ask anonymously, they could type it in and it'll just be me to see so I can answer some of the questions that I deem are appropriate. Otherwise, if people have questions that they want to raise their hands or ask or just shout out, then I'm more than open to answer any questions. And my email is here. So if you want to like email me any questions, then you can feel free. To do that.
I have a bunch of questions here.
Okay.
But Miss Cook, do you have questions from your class before I jump in from a whole bunch? I don't know if she's right there. She might be not right next to her computer yet.
We are currently question free, but we might have something as we go along.
Okay, cool. So I will just jump in. Yes, Noah, what's your question? That's very theoretical. I don't know if he would know the answer, but we can ask. Somebody who created the medicine? Okay, they want to know who created medical school in general, not University of Ottawa, just medical school.
So yeah, I guess I kind of shot myself in the foot here by opening up the questions to a bunch of thinking high school students. There's a person called William Osler who, like, everyone says is kind of like.
No, he knows the answer, so listen. Go ahead.
There's a person called William Osler who everyone says is kind of like the founding father of medicine, specifically in Canada and the States. Like, I don't know if he created medical school, but he was kind of the person that led the charge at trying to teach medicine in a structured way. But I don't know. I don't know if I'm answering your question. Yeah.
It was a good answer.
You can look them up.
Great answer, they said.
Yeah, thanks, Noah.
So my class was wondering if you've ever been tempted to quit medical school.
That's a great question. I'm wondering if I could just close this and then I'll just come like as me so I can see. Perfect. I mean me myself, I have not. But I have had classmates who did quit, or who did kind of choose that medicine wasn't the best career for them. I think it's very individualistic. Like, some people, you get into it and it might not be exactly what you expect. And I think that also the demands of being like a medical student can be quite high with like studying and with practicing, and there's so much to learn. So I myself haven't, but I have had people who have kind of came into my class or taken a year off and joined the class below me, or people who just realized, this isn't exactly what I want, because it's a long time and it's a lot of hard work. And if it's not something that you really see yourself doing, then ultimately, like, that's okay. And it's just about recognizing it. So I haven't, but I know people who have, and yeah, it can be tough. But if it's something that you really want, then it's worth working for, in my opinion.
Okay, this question, you did not specialize in surgery, but somebody wants to know what kind of saw you used to cut through bone.
That's good. So I didn't specialize in surgery, but as I said, in your third year, you have to go through a lot of different things. I don't know the type of saw, but honestly, a lot of the equipment that they use in orthopedic surgery are kind of like similar ones that like carpenters would use, or like people like people that cut through things normally. Like, they're pretty, like, even though they're like medical, I would say if I had a better understanding of saws, I would say like they're pretty similar to just your average regular saw. But yeah, not my area of expertise, unfortunately. And it's not a 2-person one, it's a 1-person one.
Yeah, they're hand gesturing a back and forth saw. Okay. Somebody wants to know, oh, this is a good question. Okay, somebody asked if you're sick yourself as a doctor, are you able to prescribe medication to yourself, or does somebody else have to do that for you?
You are not able to prescribe medication to yourself. You have to get another doctor to do it, just because of logistical reasons around like whether it's ethical, particularly like, so some medications, as you guys all know, are over the counter, so you could just go grab like a Tylenol or an Advil. But if there's going to be other like medications like antidepressants or antipsychotic medications, it wouldn't really be ethical to prescribe them to yourself. So you have to get another doctor to do that. And it's quite recommended that all doctors have their own doctor, because things can be quite stressful. So having kind of a family doctor or someone that you can talk to about some of the stresses that are happening is encouraged for sure.
Okay, what was your question, Jesse? Yes, absolutely. He says, would there be a situation where they would have to use a drill?
Yeah, all the time. Like in orthopedic surgery, like all the time.
Yeah.
Yeah.
I don't think it is, but I'll ask. They want to know if your handwriting's messy.
Mine is not.
Yeah.
No.
No.
But I guess it depends. Like it's not if I'm slow, but if I'm really busy and it's a fast day, then maybe it might get a little bit sloppy, but it's not that messy, honestly.
It's legible.
It's legible, yeah. The spelling might be wrong though.
That's all right. Okay. Another question. What kind of personal traits do you think are good for somebody who would want to be a doctor?
Sure. Yeah. So this is a tough one. I guess I would say, like, first and foremost, that there aren't particular traits that make someone a great doctor. There are some things like being empathetic. So like being able to share in someone's experience and to be able to support them through it. I think having empathy is something that's very important. And something that like you probably wouldn't be a good doctor if you didn't have that. There's also there's a thing called can med, which is essentially like the different personalities of a doctor and the things that they want. So there's like being a leader, being a good communicator, being a good collaborator, being a professional. So that means kind of understanding your rules and regulations and staying within it. Being a scholar, so like doing research and like working to improve the field. Like those are all things that are important. I would say from like a personality perspective also, each specialty has their own personality traits that so like what a surgeon might how a surgeon might respond might be different than how a family doctor or a psychiatrist might respond. So I would say there's no specific traits that make someone a better doctor. Being empathetic is very important, and then just being like a good communicator, a good collaborator, working well with people, being like open to learn and make mistakes because you're inevitably going to make mistakes and you have to be able to learn from it. Being interested like in science and like helping people, I think. But otherwise, like I have people in my class who are more reserved. I have people who are more outgoing. Like I think for personality, really, you can find a spot that fits for you, personality wise, as long as you care about others and you want to help. And you're hardworking.
My class was really interested in knowing if there is something that grosses you out as a doctor.
That's a great question. I think I would go back to the cadavers. I think like in my first year, that was a big shock for me, like seeing someone who has like died, and their body's preserved and like you're cutting them open and like looking in. I think that was a big shock and something that took a lot of time of getting used to. Um, Otherwise, there's like so many things that are just really gross, honestly. Like different infections and like when people have like collections of like pus or like fungal infections and stuff. So a lot of times, like you do have to kind of like look at them or investigate them or touch them or take samples. And I think like a lot of medicine is kind of like gross. But at the same time it's like fun and it's interesting and it's never a dull moment. So like if you're working in the emerge, you never know what's going to come in. So I would say there are certain things that kind of gross me out, but I think also as you get more exposure to it, it kind of becomes like a normal thing. So a lot of times patients will come in and be really self-conscious about things and be like, I'm so sorry, like you have to look at this, like it's so gross. And I'm like, I see this every day. Like, don't worry about it. This is like run of the mill for me. So I think, yeah, there are things that are kind of gross, but over time you just kind of get desensitized to it and it just becomes your normal.
They want to know if the cadavers smell bad.
They don't. They smell like I don't know what the word is. It's like I don't know if it's fluorescein or something. It's there. It smells like a chemical. Like they don't smell like dying bodies or dead bodies. Like they smell like a chemical that's used to preserve it. So there's a
What?
question. There's a question in the. There's a few questions in the poll, but I think only one of them are serious. So I'm just going to answer the one that I feel is serious. It said, in order to be a type of doctor, would you have to do well with like dealing or looking at blood? And I feel like sometimes like I've had students or not students, classmates who have actually been squeamish of blood or like who don't love blood. And I think that it's something that is kind of part of the job. But I think if it's something that you're actually struggling with or have problems with, that like they can find ways of navigating it. And like I said with like the gross things answer, there's lots of exposure to it. So as long as you like keep seeing it and keep seeing it, I think like eventually you'll get over it. Because that's kind of how you improve from that side. But yeah, I mean like as a lot of doctors, like as like psychiatrists, you're dealing with mental health. Like you're probably not going to be exposed to that much blood. So there are different ways that you could pick different specialties if that is something that was actually concerning to you. But through your training, you're going to see a lot of blood. But just with time, it becomes more normal.
There's another question here that's a good one. It says, how do you deal with like stress? And then like kind of goes along with another question of like, how hard is it to know like, oh, the decisions that I'm making are like directly impacting the patient? So like that's kind of stressful. Like how do you deal with that stress or just stress in general?
Yeah. So this is a question that like I'm going through interviews right now, as I said, and this is a question that comes up a lot because inevitably medical school is stressful, and especially when you become a resident and you are the one that's making the orders and you're the one that's in charge of actually taking care of the patient. And then even when you transition further and you become a staff doctor, then it all comes back to you, right? Like anything that happens, any people that are working for you, if they make a mistake, it's yours. So it is a lot of responsibility and it can be stressful. I think from a medical student perspective, kind of those hobbies that I spoke about are really important. So like doing things outside of medicine that help you like to relax or de-stress. So whether it's like playing sports, whether it's like doing yoga, whether it's like going for runs, like whatever it is, like those things are important. And then I think like having a good support system. So like whether it's your partner, whether it's your family, whether it's your friends, like having people that you could talk to about it if it is really stressful. I think also something that is important is understanding that you're going to make mistakes. No matter what, like no matter what you do, even if you're a perfect student, you're going to make mistakes because there's just so much to know. And it definitely is something that a lot of medical students struggle with because they're kind of the people who get the best scores and like they're doing so well in their undergrad, and then they come into this environment where like everyone is like that. So you're inevitably going to be like worse than some people, or you're going to make mistakes. And a lot of times, like in medical school and in residency, those are the times to make mistakes. And although like anything that you do impacts the patient, there is a staff there or a doctor there that's overlooking you. So like hopefully they can catch it. But yeah, it's really stressful when you think about the fact that like what you might do or something that you might miss or a prescription that you might give someone is kind of impacting their life. So I think just understanding the significance and importance of that and doing your best to kind of provide care for them, and not being too hard on yourself, and then finding ways for you to de-stress or decompress outside of medicine is important. But it's a tough one.
Okay, what was your question, Kyle? I'm assuming admissions, but I'll ask. Why did you decide to go to U Ottawa and not other med schools?
Yeah, that's a good question. Specifically, I went to U Ottawa because my partner was going to Queen's University. So it was close in proximity. Also, there's a lot of components. Like I had gotten into a few different schools. Like I got into Memorial because I'm from Newfoundland, but I didn't really want to go back to Memorial just um, geographically. And then I had gotten into Toronto, but I had heard that maybe the atmosphere in Toronto was a little bit more competitive, and that Ottawa was a little bit more collegial, so people worked together more. And coming from out east, like I know that we put a lot of value in like working together and talking to people and having fun. And I just was worried that maybe going to Toronto would be a little bit too big of a step for me. So that's essentially how I picked Ottawa. And then also having those half days off is really nice because you have a little bit more control over your time. And as a medical student, like you don't get that much control. So being able to like have those half days where you can do things that you want were important to me as well. So those were all reasons, but also because also a lot of people say with medical school, it's not like why I picked the program. It's like if the program picked me, because a lot of times you'll apply to 10 different programs and like you'll get into one and then you kind of have to go there. So I was fortunate in that I had some choices. But yeah, that's kind of why I picked Ottawa. Also, it's a nice city.
I don't think so. We're not getting into that. Okay, another question would be, let me see. Is it easy to find a job after med school?
Yes and no. It depends on what you do. If you want to be a family doctor, then you could find a job in a minute. There's so much demand and so much need. If you want to be a plastic surgeon, then you're probably going to have to go to a specific area in Canada that needs a plastic surgeon. So it really depends on what surgery or what specialty you want to do. Um, and also it fluctuates with the times. Like now family doctors are needed. Now there's a big demand for like psychiatrists and stuff like that. But um give it 5 years and it might switch the other way where there's so many of those and well, I mean not family doctors, there's always going to be need for family doctors, but there might be so many psychiatrists in 5 years that like actually there's more spots in surgery. So it does fluctuate, so it's hard to follow. But overall it depends on your specialty. And if you're the more specific that you are, like the more that you go into a specific area, like say urology, like you're like a P doctor, um, the harder it is to find jobs because there's less jobs available, and it's more specialized.
I'll do like one final question and then I'll leave a little bit of time if Miss Cook's class has one final question if they do. But somebody asked, which I thought was an interesting question, was how do you feel about giving medical advice to people outside of the workplace? So say if like a friend, like say if I reached out to you and was like, hey, this and this is going on with me, like, what do you think? What do you think about that?
Yeah, I think that's tough because you get that all the time. Even when I was in my first year and like I didn't know anything, um, I would get like family members messaging me being like, "Hey, I have this weird rash. Like, what is this?" And really, like I didn't know. I'd be like, I don't know. Like, it looks kind of weird." So I think it's tough because you want to help your friends and you want to help your family. But at the same time, it's like you need to kind of keep that level of professionalism. Um, I mean, the textbook answer is that like oftentimes you'll tell them like you need to go see your family doctor or you need to go to the emerge, like if you're worried. I think what a lot of us do is kind of a mix of that. So I think like if it's something that's quite obvious, like I would feel comfortable being like, oh, I don't think I would worry about that. But if there's any question in my mind or like anything that I'm not 100% sure of, I would probably just say that they need to go get help. And you don't want to be the one responsible for kind of like downplaying it and then turns out that it was like something that was really serious. So like overall I definitely would lean more towards telling them to go get like professional help. But if they have the simple questions about something, like say if they're like worried about the side effect of a medication that I could just quickly look it up and give it to them. Like I would obviously try to help them, but trying to maintain professionalism is important. But it can be tough when you're trying to balance relationships with people.
Absolutely. That's amazing. Oh, just a sec. There's an announcement. Okay, that was awesome. I just want to thank you so much for coming and talking, and they were all very engaged, loved your presentation, loved being able to ask their ridiculous questions. So that was awesome. Like, thanks so much for taking the time to come chat with us, Adam.
Yes, thank you very much.
No problem. Happy to help. I hope it was informative.
It definitely was. It was really good. I'm just gonna stop recording before we continue chatting.